Thank you for being here to listen to my short presentation. I come from Italy, from National Research Council, and my research is about trauma. I'm a psychotherapist and I work currently with these robots, which help us to heal our young patients in a hospital from PTSD syndrome. That means post-traumatic stress disorder. This happens because our patients live in a long hospitalization. They live in the hospital for years, and they suddenly have palliative therapies. So it's really a difficult moment of their lives and their parents' life. What happens in this traumatic situation is that PTSD brings our patients and their parents to have an ability to process the trauma, especially in autobiographical memory. That means a fracture of identity also in our young patients. That means loss of agency in the world. So they live constantly in this hospitalization and feeling totally apart from the social life. This is why it's so important to treat the PTSD syndrome even before it starts and before it chronicize. So we work on trauma from the beginning, and we use with kids these robots like our funny toys to help them, especially in that cases where we have an immunitary severe syndrome, where some our personnel cannot have daily contacts physically with these patients. What happens to them is clearly shown in this picture that shows us an iceberg. PTSD is like an iceberg. You can see just a little part of the problem of this really complex situation. You see a kid or an adolescent or their parents in this hospitalization situation, but underneath the surface, you see a lot of correlations in physical and mental health. Mostly, we have a breakdown of stability, identity. So they start feeling suddenly overwhelmed, and we have identity breakdown. So we try through this EMDR technique that I show you in a few moments to restore a sense of safety and to increase self-esteem toward a reward and a sense of trust through a game that we play with these robots. This is what happens to our cortex when we have a trauma. We have a lot of different parts of the limbic and cortical system. There are hypo and hyperactivated. Especially, we have an impact on endocrine system, especially on HPA axis, because of the cortisol production, of course. So we have a general immunitary activation, and this is really dangerous for patients that have chronic immunitary disease. So we have to be really careful in managing the trauma from the really first symptoms, because it affects their immunitary spectrum and also a lot of different correlates. We use this technique that comes from psychotherapy, the really modern technique that comes from the United States, that's called EMDR. That means high movement desensitization and reprocessing, because we use the movement of the gaze to increase the infrahemispheric dialogue. So we work on this with this bilateral rhythmic eye movements, not only with the gaze, but also with the sound. Our patient have this, I will show you a picture. This is the last publication we made on brain science and also on Frontiers about this pilot study, which we use these headphones with a LED, and we follow the gaze of our patient. This is an adult parent of our patient. We have this headphone with the LED that helps us to coordinate this bilateral simulation with the gaze and the sound. What happens is that we try to distract the sensory motor cortex with the binaural grounding and the ping, a neutral ping that's based on the frequency that goes from 430 to 440 in progressive dichotic deviation. So we stimulate the tonotopic maps related to spatialization. to disrupt their cortex and to go to the limbic system, especially on the way of where and what. They are dominated by hippocampus and amygdala. They are the main characters involved in a trauma. So we use rhythm basically to coordinate the action of the somatosensory motor, visual and auditory cortex, and the infrahemispheric dialogue between the two hemispheres of the brain, of course. This involves a lot of different networks. The verbal network you see here, the Broca area and the Wernicke area that coordinates to the visual cortex and also the somatosensorial cortex. And this leads the limbic system to reprocessing the traumatic memories, especially the memories that are started to be assumed by the brain during this long and really heavy hospitalization with these terminal patients, unfortunately. We had some tests we made in our pilot study. We used different instruments like CBA, do a cognitive behavioral assessment, which helped us to collect some data about the progression of this technique that's based on 8 different phases that you can see here. We have the anamnesis with the test, and then we have the assessment. And the main phases of this therapy are the desensitization and even the installation of new positive cognition in our patients. And then we use also music to help our kids, but also their parents, to have a body scan phase, during which they try to understand if they still feel some problems in a physical assessment. So we use this kind of test. There's a well-standardized test. Thanks to this CBA, we can measure the levels of well-being, change, anxiety, depression, and social discomfort. And then we had an ANOVA analysis of our dates, and we verified this increasement EMDR plus, which is the difference between EMDR and EMDR plus. In EMDR, that's the traditional technique I mentioned, you just have the gaze, so you move the eyes basically. And in our cohort of EMDR plus, you can have this rhythmical musical sound to help the spatialization and the dialogue between the hemispheres, and also the help of music during the body scan. So we use music as a reward. We also checked the cortical system with some EEG with the really small set, but it's been really helpful with kids because they move a lot. And 6 patients of our pilot study have been analyzed with those techniques. And especially during the listening of their favorite songs that we use as a reward. And we noticed that this technique based on rhythmical stimulation and reward through music has been really, really helpful in terms of efficacy of treatment. It has been really helpful in memory reconsolidation in adults and adolescents, and to help sensory motor coordination in the youngest patients. And also increasing the motivation and the arousal of our patient that can incur in early depression. It's really a particular situation that we are living in our hospital. I'll show you some pictures in a few moments. Our target point is to increase the levels of adaptation. So we use music to help this patient to survive from this traumatic change of condition. You can imagine a kid, for instance, 8 years old, that has to move from his house to a hospital for months or maybe years. So it's really a traumatic situation. And we use music to feel more integrated in this new environment and to survive from psychological distress that could lead to anxiety, fear, and mostly to trauma in some cases with PTSD. This is one of our favorite robots. It's a Pepper model. This is the first one we use for the musical project. You see this robot as a screen on his chest. And in this screen, we have a colored ball that goes from side by side, leading the gaze of these kids. And also the robots plays music and sound. So this kid can have a headphone or not, it depends from their taste. And this helps them to get focused and to also relax. Those are all the models of our experiment here in this protocol we had in Padova. This is the northern part of Italy, in our hospital. And I would like to thank all my colleagues from the hospital, from the CNR, of course. And we had there 26 little patients that worked with us with this paper robots, where we tried to propose this EMDR technique through the musical project. Our main point has been to use robots to increase tele-rehabilitation and really tailored medicine psychotherapy in our case. That means that each patient makes this anamnesis describing his or her favorite music, and we use that music that's different from each person. So we have Tommy that really loves pop music, and then we have Alan that really loves rap music, and more we are close to their favorite music, the best results we get. So it's been really important to improve this psychotherapy, considering the personal musical taste of our patients. This is the application we had in the pediatric patients. We had 26 pediatric patients in our last study, from 3 to 18, and both genders. Those are some dates we got from Pesky scale, that measures the stress levels, and another scale that's called Wong-Baker. That's really, really easy. We can see here, this robot has got Wong-Baker scale that's planned for the younger patients.
We're running out of time. Maybe if you go to the results, I think that
those are the last few things I would like to say. EMDR has huge results in treating PTSD syndrome, and it's really important to consider to apply this technique to psychotherapy also in hospital, because we have really difficult situation there. And robotics will be really, really helpful with us, because it's really effective and could improve a huge spare of time and economical resources. So with a small investment in a robot that's interactive, we can have really wonderful results for our psychotherapeutic medicine in trauma. Thank you everybody for your kind attention.